doing my screencast on coconut oil pulling and its oral health benefits. You can see this is Dr. Josh Axe. He is doing his video on coconut oil pulling benefits and how to do the coconut oil pulling, which he is performing right now, which is basically swishing around coconut oil for 15 to 20 minutes in your mouth and then spitting it out. He claims in this video that it decreases bacteria in the mouth, decreases gingivitis, gum disease, and tooth decay. He also claims that it whitens teeth, heals bleeding gums, removes stains from the teeth, strengthens jaw muscles, and he says it overall cleanses the mouth. And also, some people claim that they have weight loss as well. So to look at these claims, I went into the research and I searched through the George Fox Library with the keywords of coconut oil pulling and oral health and research. And I found this randomized crossover clinical trial that looked at the efficacy of oil pulling therapy with coconut oil on 4-day supragingival plaque growth. They looked at the benefits of coconut oil being anti-inflammatory and antimicrobial. And they wanted to evaluate the plaque inhibition effects of oil pulling using a 4-day plaque regrowth study model. Overall, there's 29 participants, 18 female and 11 male, ages 18 to 52 years old. They were referred to the Basket University of Dentistry back in 2019. Written informed consent was obtained by each participant. This is a single center observed mass crossover design with subjects randomly put into the two groups. The first group was the control, which was a CHX, which is a 0.2% chlorhexidine mouth rinse used at 10 milliliters twice a day for 30 seconds. And then coconut oil group was the second group, 10 milliliters twice a day, 15 to 20 minute rinse. There was a 2-week preparatory period where patients had to self-perform scaling and polishing for plaque control. And then on day 1 of the 4 period, patients came in and had to have a plaque score of 0 at baseline. So they went through another scaling and polishing to remove any plaque or stain. During the 4-day period, patients were asked to refrain from all forms of tooth cleaning and to apply the rinsing as told. Mouth rinse was used after breakfast and dinner, and the subjects were told to avoid rinsing, eating, drinking during the first hour after rinsing. So after this 4-day period, patients came in on day 5 to have an oral soft tissue exam where the plaque score was taken again. The gingival score, staining, and bleeding on probing was also taken as well. They were also given another polish and cleaning to remove any stain or plaque on the teeth. After that, there was a 14-day washout period where things kind of went back to normal, and they were given patients a questionnaire that looked at the flavor of the mouth rinse, the perception of plaque reduction, staining, nausea, and any preference of the product. So data analysis was performed on the individual plaque index, gingival index, stain index, and bleeding on probing scores. So data analysis was performed on the SPSS Windows and Mann-Whitney U-test was used to determine the differences between the two groups. So overall, there was no significant difference between CHX and the oil pulling in terms of full mouth plaque index, gingival index, and bleeding on probing scores. The only difference was the stain index was higher on the CHX group, especially in the posterior areas of the mouth. The questionnaire results, people really liked the taste, and the taste perception was better for the oil pulling. 48.3% said that they prefer the CHX mouth rinse. 51.7% of the patients said that they prefer the oil pulling method with coconut oil. So overall, the 4-day plaque regrowth model showed that oil pulling with coconut oil had similar inhibiting effects on plaque regrowth. So they're pretty much the same. I think people really enjoyed that coconut oil doesn't have a lingering taste. It's not staining to the teeth. There's not a lot of allergies. It does, though, create some muscle fatigue because you're going for 15 to 20 minutes swishing it in the mouth, which this video by Dr. Josh Axe says that you'll have jaw strengthening. So that's a little bit different between the two videos. Overall, this study had a pretty small sample size and basically said that they don't know if coconut oil should replace this gold standard mouth rinse yet, but it's kind of left up for personal preference. So this study did hit some of the claims in this video, but then didn't at the same time. I think there's a lot of mixed reviews about this coconut oil pulling. And again, I think it's just left down to personal preference, but it does have some benefits to oral health. So thank you so much for listening.